Do we have too much government?
We need to put people ahead of corporate profits.
This system is so lopsided.
This threat is a real threat to democracy.
And I think that's really important. That's something we haven't been doing in this country for a long time.
Where do you start? What do you do? How do you do it?
Access to Democracy and other Eagan community television programming is supported by Thomson Reuters, makers of Westlawn Next and based in Eagan. Through Westlawn Next and other innovative online services, Thomson Reuters is the world's leading source of intelligent information for businesses and professionals. Online at thomsonreuters.com. And by U.S. Federal Credit Union, the member-owned financial institution offering service, value, and experience you can trust to the greater Twin Cities community.
Welcome. Access to Democracy returns. Alan Miller at the helm, and we have a return guest. You know, we're very lucky in Eagan. You wouldn't expect necessarily that 68,000 city of Eagan, Minnesota would have one of the world's leading doctors. But the fact of the matter is, and he's been here before, Dr. Charles Crutchfield, a dermatologist, is recognized certainly nationally and internationally. And it's always a pleasure for you to get away and come over here and share with us.
Well, it's always a pleasure to come and visit. This is one of my favorite things to do.
Good, because it's one of our favorite. Not only that, he's a man who goes to the Twins games. He's the dermatologist for the Twins, why wouldn't he? And how many other sports teams?
Yeah, we take care of the Timberwolves and also the Wild hockey team and the Vikings.
That
and
pretty
Lynx.
much covers
and
it.
the Lynx. So
We have to get you the Saints, and then it'll be.
then it'll be So
Yeah.
yeah, I'm going to the Twins game this evening, and I know that you're going too. And I'm torn because you're a Yankee fan and I'm a Twins fan.
No, I am a Twins fan. Interesting story that will take more time than it's worth here, but I had been raised a Yankee fan, and when we moved out here 17 years ago, Sharon and I, who was a Cleveland fan, we went to the Metrodome. This was in the really down times of the Twins.
Mm-hmm.
The Yankees came in. It's like the limousine pulling in with the rich guys and their $180 million payroll, and the Twins with their $17 million payroll. And how can you not really, really root for them? And then I got involved with Minnesotans to save the Twins when it looked like we were.
Yep.
And from there, it just kind of escalated. And we have a lot of friends on the Twins. We've interviewed probably 50 or 60 of the players over the years.
Very nice.
And so we are imbued with the Twins.
Well, then I would say that since it's your birthday today, I hope your favorite team wins tonight.
I certainly hope so. Thank you. We have a good pitcher going for us. Let's cross our fingers.
All
Maybe
right.
they'll get a few hits.
Yeah.
And not only that, but you vacation in Puerto Vallarta, Mexico.
Right. One of our favorite spots.
And so do we, and we love it. So
Well, hopefully we
it's
can get
like
together
a
next time.
homecoming.
Yeah. We get together next time down in Puerto Vallarta.
So, one of the things, as we put up some of the graphics on the screen, one of the things that we put up is the fact that you had a really unique experience recently when a young man, I think a young athlete, came in to see you, and he was with his father, who had on a short sleeve shirt. And that man today will say that Charles Crutchfield saved my life. So why don't you recount that story?
You know, it's an interesting, it's a throwback to something that we were dealing with when I was a resident. And we did a major paper, we did a survey, and we called it the Capital City Survey. We called 10 people in the capital city of every state. That way we'd have a survey size of 500 people, and represents all 50 states. And so this was something that, as a dermatologist in training, you're always thoughtful and mindful of. And the question we would ask people on the telephone survey was, if you were in a non-medical setting, like a grocery store, a movie theater, shopping mall, and a dermatologist saw a lesion on your skin that looked suspicious for skin cancer, would you want them in a quiet and private manner to pull you aside to mention it so you could have your regular doctor or dermatologist see it in the future? And the results were fascinating. What do you think people would say?
I would think they would say yes.
They did. 94% of people said yes, I would prefer that they do that. There was only, and we looked at it in the teenagers, 20s, 30s, 40s, on. There was one group, however, that was a complete outlier. They said, absolutely not. Don't care about it.
And that was?
80 and above. So,
That's
and I talked to my guy, he says, listen, I got enough going on, don't bother me about that. So, but it's, anybody under 80 said they would very much like to know. And I'm sure many of the people over 80 would like to know too. So it kind of goes back to that, and that's one of the things that I've run into over the years with my wife. When I go to the shopping mall, or when we go out, and if I see something that looks suspicious, I always mention it. And sometimes, one time I was going down the escalator and the person was going up the escalator, so we had to cross. So I had to quick run down the bottom and take it back up, and I was taking these steps 2 at a time so I could catch up to them. And so I could tell my wife, said, oh, here he goes again. But I always do that, and that's something that we were trained at the University of Minnesota. I trained at the Mayo Clinic. It's something we always do and try, even when we're not in a medical setting, to do that. Now, this time it happened to be in a medical setting.
It happened in your office?
It was in my office, but it wasn't my patient. I was seeing a teenage boy for acne, and that's a common thing that we see patients for. But as I was leaving the room at the end of the encounter, his father was with him, and he was putting the magazine back in the rack we have in the room. I guess he was looking at it before I came in. And he was putting it back, and as he moved his arm to put the magazine in the rack, I saw a dark mole on his wrist out of my periphery. And I left the room, and as you know, I heard this little voice say, you know, you should probably go check that. And then I looked up, and I had a couple charts up. I was running a few minutes behind, and I thought, well, I'm running late, and it wasn't his appointment. Maybe I'll make a note in the chart. Their next visit, I'll take a look at it. So I was going down the hall to go into the next room, and that little voice is a little bit louder, said, hey, I told you, just go take a look at that. I thought, okay. So I went back and I told the father, hey, I'm sorry, there's a little spot on your arm. I just want to take a peek at it. It looked a little bit odd. I noticed as I was leaving the room. And I looked at it again. I thought, this looks worrisome. As a dermatologist, we've seen, in fact, one of my colleagues told me, he said, at our age, I'm 54, he said, our age, we've seen 1 million moles. So I thought, after seeing 1 million moles, this one looks a little bit peculiar. So I told him, I said, I would like to take it off. He said, I'm really in a hurry. My son is late for school. We've got to go. And I said, you know what? It'll just take me 2 minutes. He said, you know, I tell you what. He said, I'm in between insurance. I said, no problem. We'll just pay it when you can. We'll just take it off. And finally, when I got him enough excuses, he said, you got it. Let's take it off. And so we did, and we found out there was a melanoma. But we caught it very, very early.
And melanoma is the most serious type of
It's the most
skin
deadliest
cancer.
of skin cancers. And untreated, the mortality rate is somewhere between 80 and 100% untreated. So, and even when it's caught, the mortality rate is 30%. But
Because
this
it
one
spreads, as I understand it, like crazy.
like crazy. And you know, when I lecture the medical students and the residents, I make a bold statement sometimes. I say, there's nothing wrong with having skin cancer. And you say, oh, there's nothing wrong with having melanoma. It's the metastasis of melanoma that will get you. Now, if you had a little skin cancer that just stayed right there in your wrist, who cares? But when it breaks off and it travels through your bloodstream and it lodges in your lungs, in your brain, in your liver, and takes those organs over, that's how you end up passing away from it. And melanoma is really efficient at breaking away, metastasizing, and killing people that way.
So the bottom line to that story is?
I tell patients, see-spot change, see a dermatologist. And if your dermatologist says there's a mole that you should have looked at, have it looked at.
And the fact of the matter is, with that gentleman, you found out it was a melanoma.
Yep, the pathologist called me 2 days later. It was a melanoma. We scheduled surgery, got it taken care of, and he's completely melanoma-free to this day.
And that young man says that you saved my father's life. And there was a nice story about that. I think CBS did it, or somebody did it.
And I certainly take credit for that event, but that's something that I know all of my colleagues and all dermatologists would have done the same thing that I did. So.
It really says something about, you have such an incredible practice. I mean, you have, what, 30 or 40 people working for you, and yet you perform everything medical. Now, I've been there. I've seen you going from room to room to room. I don't know how you do it, but you do it. Now, you tell me you have a great backup staff, which is true. And you're always in charge of an intern or two following you through from the medical school.
Yep, usually have residents and medical students at all times. But I think that's so important because I was a medical student. I was a resident one time, and I had to learn. And it's so important to give back and teach the other students coming behind us, because if we don't teach them, how are they going to learn? So I usually have that with, but you're right. The way to do it is to have a great support staff. And so even though I do all the doctoring, which is important, my support staff helps me with all the ancillary matters. They help write the prescriptions, they help with the charting, they help educate the patients, but I'm making all the diagnoses, I'm deciding all the medicines they will get, I do all the monitoring to make sure everything is okay. So it's a great system, but I think it really works very, very well, and I think the bottom line, it serves the patient much better, and the physician's happier, which in turn serves the patient better.
Now, you have so many publications, I don't know where to begin. But you do, on one of your recent publications, show us various types of melanomas. And if we can bring some of them up on the screen, if we can interrupt Mary in the control room and get her to turn, and there we go. We'll bring some of these up, and you can describe to us what you see.
Yeah, and so a lot of patients, when they're wondering, what do I look for when it comes to skin cancer? I say the main thing is look for changes, and then let your dermatologist take a look at it, and they can decide, because I can't teach you how to be a dermatologist in 5 minutes, but I can tell you some things that put them at high risk. And so
now on the left here, what do we have?
And these are both melanomas, and these are bad actors. These are very, very, very bad actors. And so we call it the ABCDEs of skin cancer. A stands for asymmetry. So if the mole itself can't be folded back on itself smoothly, it's asymmetric, that's a warning sign. B stands for border irregularity. So look at both the borders. They're not round and smooth. They're very scalloped and wavy, and they undulate as you go around. C stands for color variation within the mole.
Let's bring up the next.
I want to stand with this one.
Okay.
The C stands for color. We'll go back one.
You want to go back to that last one, McKinley?
C stands for color variation within the mole. So you can look, there's pink and brown and tan, there are multiple colors. D stands for diameter bigger than a pencil eraser, 6 millimeters. And E stands for elevation, any of the spots that are starting to raise up and get bumpy. And you see the one on the right, it violates all of those.
Okay, let's go to the next clip.
And this too is
on the left. What do we have?
These are both the same lesion. On the right, it's just magnified a little bit more than the other one. Now, the other thing for E means evolving. So anything that's changing rapidly, and this patient came in and said this mole had grown over 3 months from nothing to this. So that violated the E, evolving and changing, and it was dark. And so I tell patients, if you see anything that violates any one of the ABCDEs, have your doctor see it promptly. 90% of the moles are fine. Only 10% are malignant, but let your dermatologist take it from there.
Next one.
Yep.
On the left, what do we got?
Yep. And that's a congenital melanoma. Some children are born with widespread melanoma, although the immune system does well at clearing many of these up, but not always. And the one on the right is just another melanoma that violates the A, B, C, D, and E's. It's asymmetric, borders irregular, there's multiple colors, diameter is large, and it's both evolving and it's elevated. It's got a big nodule in the center.
Okay, I think we have one more, if I'm not mistaken. There we go.
And this is tricky. The one on the ear is melanoma, but it doesn't have the border irregularity, but this is a metastatic melanoma. He actually had one inside his mouth, and it metastasized through his lymph, and there's a little spot on the ear, but it came from the mouth. And there's another one, that's an African American female on the right. And on African Americans, skin cancers still occur, but melanomas tend to occur slightly more frequently on the palms and soles, and that was a melanoma on the fingertip.
And you treat it the same as any other melanoma? Or?
I treat them very aggressively. Now, the gentleman on the left saw an oncologist. They had to go through additional treatment. And the one on the right, actually I sent him to a hand surgeon. She lost her finger. They said, well, listen, let's not give any chance for this to metastasize.
Better your finger than your life.
That's exactly it.
Yeah. And you, in every Minneapolis St. Paul magazine, there is a page where you deal each month with a different treatment or a different type of skin problem.
Yes.
I saw one recently on vitiligo.
Yeah, vitiligo.
Vitiligo.
Yeah.
And what is that?
Vitiligo is a really interesting condition. It happens when the immune system becomes sensitized and starts attacking your own body. And the color of your skin, and I found this to be very fascinating when I was a medical student. There are cells in the skin called melanocytes, and the melanocytes produce melanin, little packets of color that gives your skin color, gives your hair color, and as you become wiser and more mature, the melanocytes in your hair follicles don't work as well, and the hair loses the color and becomes silver. But when you're looking at the melanocytes in the skin, only 2% of the melanocytes, or the skin cells, are melanocytes. So they've got long arms like an octopus, and they feed all the other cells around it with little packets of color. And they have these little pre-made packets ready to let go, to disperse, especially when you get a whopping dose of radiation, sunlight. And so we call it a suntan. But the thing with suntans, it only happens when your DNA is damaged. Little pieces of DNA float around in your cells and they bump into the air and it releases it, almost like trying to put an umbrella up to protect you from the sun. But I was amazed that no matter what your skin color, you can be Snow White from Scandinavia or dark chocolate brown from the equatorial Africa. No matter what your skin color is, everybody has the same number of melanocytes. I thought if you had darker skin, you'd have more melanocytes. No, they just produce more color, that's all. And so with vitiligo, the cells that produce color are attacked by the immune system and they die and you don't have color in your skin. So the lighter patients
So you become splotchy.
Splotchy. The real famous person that actually really had this was Michael Jackson. And vitiligo tends to occur around the eyes and on the hands first. And if you remember, he used to wear a glove all the time.
Right.
That was not a fashion statement, even though he turned it into that. That was to cover the vitiligo on his hand because he was embarrassed about the white splotches on his hand. So he wore that glove all the time. And so, but vitiligo, your immune system attacks your own cells that produce color. So if you can turn off the immune attack, then the color returns. And it tends to be much more visible when you have olive colored or tan or brown or darker skin. Some patients with really, really light skin, it's difficult to see. But I've had patients tell me that it's socially devastating to have blotches all over and to go into a situation, especially a teenager in school. I had one patient tell me he had considered suicide several times growing up. He was so embarrassed and felt so bad about it.
Because you become so self-conscious.
Yes. And I've had other patients and their parents are concerned. They don't want to go anywhere. They don't want to go with their friends. They don't want to go to the mall because when they go, people say, "What's wrong with your skin? What's wrong with your skin?" So they just stay inside all the time. So I really am disappointed in the overall approach that many of the insurance companies has because they say it's a cosmetic concern. But this is much more than that. And hopefully they'll step up to the plate and allow the patient to get the treatments they need in this condition that can be so socially challenging and debilitating for so many people. And the nice thing is we've got good treatments for it now. And there's new treatments coming out all the time. In fact, I just went to a lecture last week from the world's leading expert in vitiligo research. Some crazy things that we're using now are working in vitiligo. For example, there's a new arthritis medicine. They're finding in some patients who have arthritis and vitiligo, their vitiligo's getting better. And some of the old standard medicines that we use for high cholesterol, like simvastatin, it too is working in vitiligo. So there are a lot of new things on the rise, and we have some special light treatments that we bathe in safe wavelengths of light. That makes the vitiligo return too. So
As opposed to tanning beds.
as opposed to that, that's a completely different wavelength. And recently there was a law that was passed that if you're under 18 in Minnesota, you have to have your parents' permission and in order to go tanning. So that's a great law. And a lot of the tanning associations saying, well, the dermatologist is just in their self-interest. And I thought, well, that's kind of peculiar because if you really want to have self-interest, you say, go tanning because you're going to get a skin cancer and then we'll keep in business. So it really is. We're trying to do the best thing for the patients.
Now, with the nice weather, I have a concept that I want to look a little bit more tan, and I see today that I do, that I give myself 15 minutes of sun a day without using any sunblock or anything. Am I crazy?
No, I think it's a reasonable thought, and a lot of people think the same thing. Plus, there are benefits of sunlight to producing vitamin D, which has all kinds of other protective factors. And so, but I tell patients, if you're really interested in the vitamin D aspect, just eat foods that are healthy, that are oily fish like salmon and halibut, and you can certainly take a multivitamin. You'll get the amount of vitamin D, and they have vitamin D supplements too. So I tell patients, you know, the thing with this, with any color, it means your DNA has been damaged, and then you're at higher risk for skin cancer. That's all. But I'm a realist, and I know how people, they like the tan look, and a lot of people say, I just want a little base. I'm going down to Mexico. Yeah, a little base. So, but I say really I recommend the sunless tanning lotions, and then wear a good sunscreen, and then supplement with vitamin D.
Now, you were involved in so many different civic ventures. You sponsor so many different civic charities and otherwise. And I found out just before we went on that you're actually doing something really unique with the twins September.
Yes.
So let's talk about that.
Yeah, we're actually doing two things with the twins. One, in August, we're doing Play It Safe when it comes to the sun. And we do a free skin cancer screening for the twins players and their families and the kids and the staff. And all the staff at Target Field. And we've done this now for 15 years. And every year, it's nice. We pick up a couple skin cancers. So that's really, really nice. We've done this screening for many years, and it's really to have the twins set a good example for the kids, because baseball's a sport that kids are outside for a long time. My 11-year-old son, he just won the Eagan championship. His team did, so go Royals. But
good for him.
These kids are out in the sun for many, many hours, and so it's a good thing to start wearing sunscreen and being sun protective and checking if any moles change. The other thing that we're doing is a giveaway, and some of the proceeds are going to be going to charity, our 5K run, and that's going to support children who go to camps with skin diseases, and also children with dyslexia, reading difficulties. And so on September 16th, we're giving away high-quality baseball cards that are handcrafted, hand-painted, of all the twins that have had their jersey numbers retired, like Tony Oliva and Rod Carew, Harmon Killebrew, Kirby Puckett, Kent Herbeck, Tom Kelly, and then one that's retired all over the league, Jackie Robinson. So those cards will be given away at the stadium, and these are heirlooms. These are the ones you keep. If you look at these cards, they've got some weight to it, and they're hand painted. So it's a nice giveaway for the twins at the stadium giveaway that day.
Just another one of the things that you're involved in.
Yeah, and I've been asked to throw the first pitch out, but I'm going to bring my 11-year-old son and let him throw the first pitch out.
Oh, that's even better.
I'll coach him, but
that's even better. Well, I told you about my episode with throwing out the first pitch a few years ago.
And I think that's a commonplace occurrence, hence I'm going to have my son do it.
Yeah, Minnesotans for Major League Baseball, which really was a great organization. I never knew why they asked me to become a member of it, with all the business leaders and bankers and everything else, but then I realized they needed somebody to serve the drinks. So that's it. And that got me throwing out a first pitch, among other things.
Very
and,
nice.
Yeah, and
it's a first-class organization. I mean, they're really top flight from top to bottom.
The Pohlad family in and of itself is really a unique family, and that's really good. It's always an education when we have you here to really talk about. People don't think about dermatology that much until something happens to their skin. But first time I saw you, you picked something up and you said, we better have a look at that. And the next thing I knew, I was recommended for a Mohs procedure because it was a cancer. It wasn't a melanoma. It was, I don't remember what.
Either it's squam or basal.
Yeah.
And those do, especially squams, they do have potential to becoming bad actors, and the basals can be locally very destructive. So they all need to be treated.
Now, one of the first times we had you on, I want to know how much of your practice was actually dermatology as opposed to rejuvenation and all these other things. And you have now virtually taken over the building at 1185, and you have so many procedures available. And I was shocked to find out that that was about 4% of your practice, and 96% was actual dermatology. I would have guessed it was 50-50 at best.
No, I think, it depends on the season and the day, but I would say that at least 80 to 85% of my practice is bread and butter medical dermatology, and 15 to 20% is aesthetic medicine or aesthetic dermatology. And the two sometimes aligns, it overlaps a little bit. You might have a rosacea. Some people say, well, is that a cosmetic thing where your skin kind of flushes and turns red, or is that a medical thing? So sometimes it's a little bit of both.
But it's very important. And as we're aging and as we're living longer, we are sensitive about our appearance.
Sure. And I think the nice thing, too, is I got a call recently I was getting interviewed from one of the Chicago newspapers, and they said, well, why are people doing so many of the aesthetic procedures now? And I said, well, one of the reasons is we've got things that really work. Before, we didn't have a lot of great things that were non-surgical that worked well. But I liken it, patients come in and they tell me that they got a new dress, or they got a new hairstyle, or they colored their hair, or what. So we do things all the time to make ourselves look better and feel better, and this is just an extension because we have we have tools that really work well. And I think my philosophy is life is too short. If you can do something and feel better about yourself, and it's reasonable, not crazy expensive, why not?
What about skin and really skin treatments to get rid of scars and things like that?
Yeah. Well, that's one of my favorite things to treat, because there are many scars, especially facial scars, that people have had their whole life, and they're really self-conscious, but we've never had any good treatments for it. Now we do a combination of laser treatments and topical medicines and injectable medicines, and we can make virtually scars disappear. And so we've had really, really good luck with that. So anytime, especially facial scars, we can definitely make an improvement on those and make it look a lot better.
And one of the things that struck me, and we talked about it briefly once, but the fact of the matter is, you will create medicines in your own lab. And I think you have a background in...
Yep, molecular genetics and molecular
Right.
biology.
And the reason is because you can charge people much less than if they have to get a prescription from one of the pharmaceutical companies.
Yes.
And so very often, as happened with me, I got a little bottle of Crutchfield.
Yeah. Well, it came from the fact that so many of my patients would come back and they would get mad at me because the medicine, you know, they went to pick it up and they said that cream is $400, $600, $800, sometimes $1,000 for a tube of this medicine. I thought, this is crazy. And they would get mad at me. So I'm not making it. I'm just recommending what will work. And I finally realized we can produce same high quality products at a much lower cost. And so our goal is to provide a lot of our patients with medicines that cost $20 or less. And so they don't have to we try to make it the same or less than a copay, so they don't have to go out.
Yeah, as a matter of fact, I paid $15 for
there you go.
A bottle, which really was very, very effective.
Yeah. So we try to do that too as a service to our patients.
And you're located right here in the heart of Eagan, 1185 Town Center, or what is it?
1185 Town Center Drive. So
That's what I thought,
we're
yeah.
across the street from Byerly's and right next door to Culver's.
And
So-
there's all kinds of construction going on behind you right now.
Yeah, they're putting up a new apartment building. City View Apartments is going to be next door, and they're going to have some new shops and stores next door. So that seems exciting to invigorate the area.
Yeah, that was a large, what, Blue Cross Blue Shield
That was a Blue Cross
building?
Blue Shield building now. It's going to be an
It's going
apartment
to
building.
become apartments.
Yeah.
Yeah. Well, I would say, and we're down to our last minute, so
All
I
right.
don't want to get into any other topics, but I want to have you back here in a couple of months, as we have been doing now. I think this is probably your third visit here.
Yeah, it is.
And it's so helpful. People have remarked to me, and we get people all the time who say, aren't you, they never know my name.
Yeah.
Aren't you the guy that had Dr. Crutchfield on?
Right.
And, yeah, I'm the guy who had Dr.
right.
Crutchfield on it.
Well, I've had great reports from my patients. They all watch the show.
In
and
the
it's good to see
Houston
that.
airport once,
Yeah.
a man came up to us
Yeah.
because they see us on YouTube, they see us
Nice.
online, and
that's
it's
great.
just, it's wonderful. But it's so wonderful to have you here where you share some of your expertise in your very unique way. You are
Well-
really a treasure, a local treasure.
Well, I'm so happy to be here, and I love to be in Eagan. I'm an Eaganite, and I thank you for having me on, and I
Thank
thank
you.
Thomson Reuters for this opportunity, too, for giving us a space.
And we go off with